Kia ora and welcome. My name is Wally Noble and I'm here with Cecilia O'Dell.
Kia ora, Wally.
Kia ora. Today we are here to learn about disability awareness and how this can impact positively on your health or disability service. The aim of this presentation is to raise awareness for health and disability providers and NGOs. The presentation is about how to provide better customer service for our disabled community.
Did you know that 24% of the New Zealand population is disabled? That's a staggering total of 1.1 million people. Here in Northland, the proportion of people with disabilities is 29%. Whatever age group they're in, our disabled people make up a huge chunk of our community. And if your organisation provides health and disability related services, we're talking about an even greater percentage.
One of the most common reasons people with disabilities struggle to make their way in public is the frustration that comes from people making broad assumptions or behaving insensitively. It is these assumptions that can turn a person with impairments into someone who is disabled. Our roving reporter, Rhonda Courtney, has been filming a series of interviews where disabled people talk about great services they have received, services that could have been better, and what really matters to them. First up, Rhonda's talking to Kim Sylvie, who was a registered nurse and is now a disability awareness facilitator. Kim has multiple sclerosis, and it will be interesting to hear her personal stories about engaging with medical professionals.
What's important to you when communicating or speaking with these health services?
I like the fact that they are open to suggestions about what I have and what I might think about treatments may be. I think having that degree of respect for my ability of knowing about my condition is important, and being open regarding that condition and what I want.
Now we're going to hear from Dr. Shane Reti about his thoughts and experiences. Dr. Reti is a Member of Parliament and a registered doctor.
What are your thoughts on the medical model versus social model of disability?
So the medical model of disability focuses on function due to the underlying medical impairment. It's all about what the underlying medical disorder is, with the belief that if you correct that, then function improves and engagement with society improves. The social model is much more around how function is integrated into society, how society considers disability and considers disabled people. Now, my view on that is that there's a place for both. I think the greater place is for the social model, that is how society views disability. Undoubtedly in the medical model there's some improvements to be made if you can improve a person's physical functioning. But I think most of the gains are actually to be made around the social model, having society rethink how we consider disability, how we collaborate and cooperate with disabled people. So to answer your question, I think it's a mix of both, but I think the social model has the greater role to play.